Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I'm here with Kelly Robke, Vice President of Clinical Thought Leadership at BD. We want to share a few moments of insight, gratitude, and inspiration with you. Kelly, thank you for taking the time to be with me today.
Thank you for having me, Bonnie. I appreciate it.
Kelly, what thoughts and insights can you share with our healthcare heroes and leaders at this difficult and challenging time?
As a nurse, I would just like to thank all of the clinicians on the front line for doing everything that you're doing. We appreciate you, we applaud you, and we value your contribution to ensuring health. And there's no time like the present for us to celebrate nurses as natural leaders in the clinical care setting, as well as collaborators with physician partners, with pharmacy partners, with physical therapy, respiratory therapy. And I think what we're seeing during this time of the pandemic is just exemplifies that. At VD, we are committed to prioritizing nurses as an opportune time for nurses innovating. We've already seen it. An example I could give you is of nurses, really wanting to preserve and prioritize their PPE, and rightfully so. So instead of going into a patient's room, gowning, gloving, using the mask every single time an alarm goes off, every time you need to titrate a medication, we've seen our nurse colleagues start to move IV poles out into the hallway and not in the room, and also utilize extension tubing so that they can provide this care in a safe, reliable manner with the technology that they know gives them additional protection for their patients, but also acts to preserve the PPE. So that's one example I would give of innovation in a time of crisis, and I encourage my nursing colleagues to continue with that. Another thing I might say is be very mindful as you look to evolve your existing care areas and expand into new areas of the equipment and the technology that you have that supports best practices. If you're changing, for example, your OR suites into areas where you can care for patients, think about how you can utilize your existing technologies in those areas, and also how you can utilize additional resources, because we're hearing quite a lot about flexible staffing as well. So think about how you could use your technology to make sure those new staff members are empowered with the protection and the optimization that your existing technology has. And also challenge your leaders, because your vendors such as BD are here to work with you as you start to evolve your care areas into expanded areas, and I'll say non-traditional care, which we're seeing in the Javits Center, which we're seeing in hotels and dormitories. It's all very important. We're also encouraging our clinician colleagues to be mindful of evolution in best practices that we're seeing from the likes of the American Nurses Association, from the Infusion Nurses Association, as well. They're all working diligently to provide the fortification of process and best practice that is evolving as we speak in times of the pandemic, like we're seeing, that really allow nurses to shine in terms of our role in healthcare. And I look forward to continuing to support that and the innovations that come out of the nursing practice as a result of this. And it's exciting times. We thank you for all that you do.
Thank you so much for shedding the light on nurse-led innovation right now, and for that cross-collaborative work that's happening among all the disciplines. It's amazing to watch that unfold, and it's so important to all of us right now. Thanks,
Absolutely.
Kelly, for your time. I so appreciate you joining from San Diego today. I'm Dr. Bonnie Clipper, and remember, at Wambi, moments move.